Welcome to Community Resources Part 1. This is the session 3 of a 6-monthly series. And I just want to say good evening and welcome. I am Elaine Vivens, the coordinator for the Children's Oral Health Coalition. On behalf of the Children's Oral Health Coalition, welcome to our virtual parent education series on growing healthy kids from pregnancy and beyond, what nobody tells you. These sessions are a unique opportunity for new and experienced parents to grow skills and awareness about kids' oral health, overall health, and well-being. We want to help parents by providing access to providers, tools, community resources, and topics on difficult conversations. The information we are sharing throughout the series is good for anyone, not just parents. If you're supporting parents, it's definitely for you. Today's session, like I said, is a 3rd in a 6th series, and it is on Community Resources Part 1. We have a dynamic group of panelists who will share information on their low, no-cost dental or medical clinic, services provided, areas covered, eligibility requirements, key information to share with providers, and tips when visiting the emergency room. We also have a couple of panelists that will share some unique community resources in the community that can help you locate additional resources. Before introducing you to our moderator and panelists, I just want to share some brief information about the Children's Oral Health Coalition. The coalition, our goal is to improve the oral health of children in Tarrant County through community collaboration. And we primarily target birth through 3rd grade children in Tarrant County and the surrounding areas. We also work with pregnant teens and women. And you're probably wondering, well, why are we out here trying to work with pregnant teens and women when we're targeting the younger children? Well, it begins at birth, right? And that we believe the sooner we start at birth, the sooner we can get them engaged with the work and the help that they need in not only the community, but to succeed in life. So we have 4 focus areas that we have, and it is awareness, prevention, education, and advocacy. And some of the things that we do from an awareness standpoint is oral health collaterals, and you'll see some of those throughout today. And we also have some prevention materials that we give out, oral health kits. We have a school screening committee that's made up of 5 coalition members, and they go out and do screenings either at schools or in the community. And we also are doing screenings of pregnant teens at in the school and community sites as well. And primarily Arlington is where we're doing that right now. From an education standpoint, we have what we call the Train the Trainer for community professionals. It is a 4-hour training, but that training is now broken down into 2 sessions that we can make available to the public. We also have what we call our Ask the Docs series, and that's education, networking, and on some level mentoring for medical and dental providers, because we're wanting to bridge the gap between the medical and dental for better care around during pregnancy for that mom and baby. And then we have the virtual parent monthly series like what we're doing tonight. And we have oral health ambassadors, who are those individuals that have gone through Train the Trainer. From an advocacy standpoint, we believe that change begins at the organizational level. And we also, as I mentioned, have what we call the Coordinated Care for Pregnant Teens and Women. And that is our pilot that we're doing in partnership with medical and dental providers in Tarrant County. And it is all about the access to care and access to coverage that those pregnant teens and women need when they're pregnant. So without further ado, I want to say thank you again to our moderators and our panelists. So for today, we have Peyton Lear, who is the Executive Director with Field Children. She will be our moderator. We have Nancy Blinn with Dental Health Arlington. We have Dr. Dinesh Gowda with North Texas Community Health Centers. We have Lee Ann Turbeville with Help Me Grow North Texas, Francis Wampler with the Center for Children's Health. So what I'd like to do is go ahead and turn it over to Peyton and ask Peyton just to share a little bit about the work that she does over at Guild Children and a little bit about herself. Thank you.
Of
And welcome,
course.
Peyton.
Thanks for having me, guys. It's so great to see everyone. Thanks for sharing your evening with us and learning a little bit more through this parent education session, especially about community resources. Thanks so much. I'd love to tell you a little bit more about what I do at Guild Children's Services. So we are a charity here in Fort Worth that provides last resort financial assistance. So we're set up to be a safety net for young people who have needs that aren't being met, maybe at another nonprofit or a government program. We can step in and pay for whatever the young person needs. So that could be a root canal, emergency childcare, prescriptions, birth certificates, diapers and wipes. We've paid for so many things, and we only have 3 eligibility requirements. First is that the child is 0 to 18. The child must be living in Tarrant County, and Guild Children's Services must be their last resort. And that's it. So when we're talking about last resort, we mean that the family's resources have been exhausted and the community's resources are exhausted. So they've checked everywhere and nowhere else can satisfy this young person's needs. So that's us in a nutshell. I'll drop our website into the chat so you can look us up and apply for help if you need it, or if you're in a position to donate, feel free to do that as well. But that's why I'm involved with the Children's Oral Health Coalition. We see a lot of kiddos who need dental treatment. And so I volunteer as the chair of the Children's Oral Health Coalition, which is why I am here before you today. So again, thanks so much for joining us. We are going to be hearing from our panelists today. They're each going to share a little bit more about their clinic, how you can access their benefits and their eligibility requirements, and everything you'd like to know. So as we're going through to our guests, feel free to drop your questions in the chat. We're going to have a designated time at the end to field some of those questions for you to make sure that you have everything you need to know. So let's launch right into it. Our first panelist is Miss Nancy Blinn. She is the Executive Director of Dental Health Arlington, and she co-chairs the Children's Oral Health Coalition Legislative Advocacy Committee, which does really great work. Nancy is a registered dental hygienist who has worked in various capacities in the dental field and throughout Arlington and other communities. So we're very thrilled to have Nancy share more about Dental Health Arlington. So Nancy, take it away.
Thank you, Peyton. Thank you, everybody. So nice to see so many people on tonight. So as Peyton said, I'm the Executive Director of Dental Health Arlington. I've been with them since about 2014. I am a registered dental hygienist, and my primary focus over the years has been pediatrics. And it's been a great segue when I came into Dental Health Arlington. We were started as a United Way needs assessment, looking for low cost or no cost dental in Southeast Tarrant County. Finding none, several community members came together and formed Dental Health Arlington. The dentist they basically started out as all volunteers, and they started noticing that a lot of the kids that were coming through were having some severe issues with tooth decay and cavities. So, and lots of pain, and they decided to go into 2 pilot project schools and teach oral hygiene instruction and give them a new toothbrush and screen the kids. And that was back in 1993. Fast forward to today, we run a school-based clinic, and we're in 40 Title I schools, which is the free and reduced lunch schools. And we screen almost 10,000 kids a year and provide free dental preventive services such as exams and sealants and that sort of thing. And we try to get them the care that they need and access to dental services, which is where our dental clinic comes in. We see about 2,500 patients a year, and we see all ages in our dental clinic from 3 to 99. We are not a free dental clinic. We're a low cost, but the eligibility is you have to be of low income, uninsured, and you can also be undocumented. We service all of Tarrant County. However, we are in central Arlington, and the majority of our patients come from the surrounding zip codes. But we do see quite a few people from HEB in West Fort Worth. We also offer just a couple of different things that kind of make us unique. We do a little bit of everything. We're open from Monday through Thursday from 8 to 4. We offer what's called kind of like a layaway program. Our patients sometimes, because it is low cost, but sometimes that's still too expensive for them. So we offer an opportunity for them to pay as they go. So they can put a little bit down on one paycheck, and the next paycheck they can put the other down, and then they can have their work done. So it's a pretty awesome program, and I'm very proud of that. So we offer all types of services in our clinic. We offer basically preventive. We do cleanings, deep cleanings, any kind of exam, whether it's an emergency exam or a comprehensive exam. We offer fillings, extractions. We do crowns and root canals. We provide dentures, partial dentures, things like that. And in some cases, in many cases, we offer same-day service. So if someone comes in as an emergency, we do try to get them in and get their most emergent need taken care of that day and try to get them out of pain. One of the things I did want to talk about is a little bit about the signs and symptoms and treatments for dental emergencies. A lot of times people are not always sure what constitutes an emergency and where they need to go once they have that emergency. I usually tell people if you are up all night, obviously, and hurting during the night, any kind of cold sensitivity, hot sensitivity, any kind of swelling, that sort of thing, you need to call your dentist. If you don't have a dentist, we need to get you into a dental clinic. But there's other emergencies that are even elevated from that. So this is kind of a list of some different things. If you have a cracked or broken tooth, or if you've been in any type of accident, that sort of thing, then you're going to want to go beyond just the dental office. You're going to want to go to the ER. If you're, experiencing some dental discomfort, you might want to rinse your mouth with some warm saltwater rinses, use a cold compress, and then again, call your dentist. But anything beyond that, if you're having severe swelling up into the eye, anything like that, you definitely need to get to the emergency room. We want to make sure we get that taken care of. That's a sign of a real severe infection. If you or your child has knocked out any teeth, that's also a big concern. You want to make sure that if you can do it, if you take the tooth, you can put it back in the socket. If the tooth is still whole, you can do it right away. That's the best long-term outcome to save that tooth. If you are not able to do that, if you can get it back in the corner of your mouth, put it between the cheek and the gum, or you can put it in a little container of milk, you want to call your dentist. And a lot of dentists have emergency after hours. So even if it happens after hours and you have a dentist, you want to call them first because they're the one that's going to be able to treat you. If you can't get in with the dentist, obviously, then you're going to head to the ER because they'll at least be able to give you some medication to help make you feel better, but you'll still have to visit the dentist probably the next day or so. Any kind of pain, swelling, fever, or if you ever have any difficulty swallowing, that's all a sign of a severe infection and possibly an abscess tooth. Again, that is elevated, then you're going to want to look into going to the ER if you can't get in with your regular dentist. Sometimes after an extraction, you can see a lot of bleeding. That's pretty normal the first 24 to 48 hours. But if it continues or suddenly gets worse after that time frame, again, you want to call the dentist first, whoever extracted that tooth, and if not, then you would want to head to the emergency room. Frequent bleeding in gums can be a sign of gum disease, but that's not something unless you're having severe pain that you would need right away in the ER. So that's kind of when to go. And that's just a few little tidbits here and there. There's a few clinics in the area. Obviously, my clinic, Dental Health Arlington, we see emergencies every day on the Monday through Thursday, 8 to 4. That's our information there with our website. JPS Health Network also has other clinics in the area, and we try to kind of work with them in tandem sometimes, and we help one another out. So we also refer over there. Mission Arlington is another option for many patients. That's a completely free clinic. If you can't afford the low cost or you're not in the JPS Health Network system, that may be another option for you. on where to go. And I know Elaine's got other, I think that's the next slide, Elaine, where you want to talk about, we've got other resources through the Children's Oral Health Coalition, and it's a great resource. We're in the process of updating it, hope to have some new information in there. So it's even beyond just those 3 clinics that we talked about. But if there is any way that we can help you at all at Dental Health Arlington, we're always willing to help. And I thank you guys for your time. And if there's any questions, I guess we'll take those at the end. Thanks, Peyton.
Thanks, Nancy. Wow, I definitely learned something today. I don't know about you guys, but you can put a whole tooth back in the socket. Okay. So should we clean that tooth before we jam it back?
You don't necessarily have to, and you kind of want to keep your hands off the root of the tooth. So great question. You want to keep it on the crown part of the tooth, because the less germs that touches anything, even if it fell on the ground, you still pick it up and you try to put it back in. And if you can do that, it has a much better chance of, believe it or not, I'm a pediatric hygienist. I've seen many that once they put them back in, they can re-adhere, and sometimes they can be healthy and you don't have to do anything more to them. So it's pretty shocking, but it can be done. So
amazing information. Okay, Nancy, also tell me about when you see pregnant patients. Do you treat pregnant patients any differently than non-pregnant? Walk me through that.
We really try to treat them as just a regular patient. That's kind of one of the things that we're trying to educate people on, is that they don't have to be specialized. Many years ago, we always thought, oh, we have to only treat them in the mid trimester, not the beginning and not the end. That's really not the case anymore. So we really try to, in fact, I had one in today. She came in today. And so we see probably in my clinic, it's not a huge number. It's probably 2 or 3 a month that I might see pregnant patients, but we also screen them out in the school. So we see pregnant teens as well, and provide the education piece. But really, as long as they're healthy, their pregnancy's healthy, there is no adverse effect to having any sort of dental treatment done. So we're trying to allay all that, those old wives' tales these days.
I love that. Okay, great. Thank you so much for sharing more about Dental Health Arlington. And again, guests, if you have any questions, pop them in the chat and we'll get to them towards the end of our presentation today.
Thanks for having me tonight. Thank you.
Oh, of course. We are going to hear from Dr. Dinesh Gowda. He is with North Texas Area Community Health Center in Arlington. And Dr. Gowda is a board certified pediatrician with a special interest in pediatric asthma and newborn care. And he may be new to the Arlington area, but he brings with him well over 15 years of experience and numerous recognitions for his work in pediatrics. So thanks so much for joining us, Dr. Gowda, today and telling us more about North Texas Area Community Health Centers. So take it away.
Thank you. Thank you for the introduction. Good evening, everybody. I'm Dr. Gowda. I'm a board certified pediatrician, and I work for Arlington Health Center, which is located at North Cooper Street, which is a part of North Texas Area Community Health Center. We have like 3 centers. I think one is located in Fort Worth, north of Fort Worth, the other one south, and one at Arlington. So we are a community medical practice, like a community health center. So it's not just pediatrics. We also see, adults and some GYN practice, some mental health. So, we serve the community. So we are a federally qualified health clinic. So we accept all different type of insurances, and we see all different patients. We also provide some financial assistance program based on income and based on the number of family members. They have a sliding scale, where they come up with. It's not free, but very discounted. And also we have a lab here. Even the lab work, all the blood work is at a discounted rate based on the sliding scale. Yeah. So these are some of the services. Previous slide. Yeah. So we provide a comprehensive pediatric care right from newborn all the way to 18 years. So we do vaccinations, and we also do sports physicals, and we try to give the same day sick appointments. Those are the few services we do. Next slide. Uh, Today, I'm going to talk about what are some of the real emergencies and when do you have to see your pediatrician, or when do you have to go to the urgent care or emergency. So when should I take my child to ER? Unless you have a real emergency like a broken limb or seizure or you're unconscious or anything serious like that, it's always a good idea to call your pediatrician's office, uh, and get their advice. They usually have somebody to answer your calls, like a nurse, or sometimes if the pediatrician himself can answer. They even after hours, typically they have a nurse line where you get some answers, whether to go to ER or whether you can wait, symptomatically manage and wait till next morning, right? So one of the most common symptoms we see is fever. So fever for us is more than 100.4. So just having fever is not real emergency. Uh, there's one exception: if baby is less than 2 or 3 months old and has not received any shots, that might be a real emergency, and you'll have to take the baby to the urgent care, to the ER, if especially if your pediatrician is not available at that time. Um, but older kids, uh, toddlers and older kids, if they have fever and you're able to manage fever with Motrin or Tylenol, and once the fever subsides, they're all up and running and active. Those kids, you can definitely wait to see your pediatrician next day morning. If if they're sick looking and if they have a persistent fever which you're not able to break by giving medication, or if the fever is going on for more than 5 days, that's the time probably you'll have to get immediate care. Next slide, please. So vomiting and diarrhea. So these are other common symptoms. Um, but most of the times they have a stomach bug going on, so you can always wait to see your doctor or call your pediatrician's office. But make sure that your kid is well hydrated. Uh, give them Pedialyte and plenty of liquids to maintain hydration. Um, but if they have vomiting after head trauma, that's probably an emergency. And vomiting with severe abdominal pain with a fever is probably suggests appendicitis, and that's an emergency. If they have green vomiting, probably that's an emergency. If they have diarrhea with a large amount of blood, they can have like little small amount streaks of blood, but if they have a large amount of blood, probably that it's a good idea to go to the emergency. I always watch for signs of dehydration. Uh, some of the signs, if your child is crying and you don't see any tears, or you've not seen at least like one or two wet diapers, uh, or if the child is very fussy, those are some of the signs of the dehydration. Probably you'll have to take the child to the urgent care or emergency for IV fluids. Next slide. Yeah, so these are some of the signs which are very concerning, and you have to get medical care immediately. If your child has trouble breathing, probably has asthma, other things going on, so that's the real emergency. If your child has an allergic reaction, if it is just a rash, you can always wait. But if they have respiratory symptoms like cough, trouble breathing, and swelling of mouth and tongue, uh, probably you'll have to go to emergency. And obviously, these are very straightforward: unconsciousness, broken limb, seizures, and bleeding which cannot be controlled are some real emergencies in pediatrics. Next slide. Things like cough, cold, runny nose, earache, sore throat, just a rash or UTIs, minor cuts and bumps, sinusitis, sinus pain, some skin problems. These are real office visits. You don't have to go to the urgent care or the emergency. Thank you. Thanks for providing me an opportunity to talk.
Thank you, Dr. Gowda. That was very helpful. I know it's hard for parents to decide, do I wait till the morning to call my pediatrician, or do I just take them into an urgent or emergency? So thank you so much for providing us some really concrete examples. So let me ask you a question, Dr. Gowda. Do you find that there are pediatricians in most ERs, or should parents be looking for ER that's specifically for pediatrics?
Not necessarily. Most ERs are staffed with ER doctors, and ER doctors are also trained to treat pediatric emergencies. When they do their med school and residency, they always rotate through pediatrics, so they are well trained. So my advice would be to go to the nearest ER if it's a real emergency.
Good advice.
But
Well, thank you so
if
much
you are
for
going to urgent care, if you're going to urgent care just because your pediatrician is not available or after hours, then probably it's a good idea to go to pediatric urgent care because they're staffed by pediatricians.
Okay. That's great to know. Thank you so much for providing all this helpful information, Dr. Gowda. And again, guests, if you've got questions for him, pop them in the chat and we'll get to them later on this evening. Okay, so next we are going to be hearing from Leanne Turbyville. She's the program director for Help Me Grow North Texas. Leanne leads the call center and on-site navigation team, which provides direct support to families for the program's 18-county service area across North Texas. And she's previously worked with the Department of Family and Protective Services HOPE program, and serving direct care and leading teams providing trauma-informed services for families of young children. So very excited to hear more about Help Me Grow North Texas. Leanne, please share all the information you've got with us.
So Help Me Grow North Texas is a program for families who have children under the age of 6, looking for some help finding resources in the community. And also we offer developmental screening for children who are 0 to 6. Help Me Grow North Texas it's really a systems model. It's not necessarily just a program. So it's a combination of multiple providers who are coming together to support this model in helping families connect with resources that would be helpful for them. And Help Me Grow North Texas is the call center is primarily housed at MHMR Tarrant County. The call number that you see here is available. We have family navigators who are available Monday through Friday, 8 to 5. We have a team of navigators who are there to offer support and answer questions that you may have about your child who's under the age of 6. So they are a group of not environmental specialists, but early childhood specialists who have worked with children for many years. And so they're quite versed on the different developmental milestones that your kiddo would be going through. So the number is right here. This is our website, helpmegrownorthtexas.org. And on the website, you can connect as a family member with the navigator by clicking on one of these tabs. You can also, if you would like to send in a direct referral, maybe you want to do that by, through the online connection here, you can do that. If you would rather send it in, or if you would like to call, that's the most popular way that families connect with us. And so after you call the number or send in your information, a family navigator is going to talk to you about what concerns that you may have about your child. They will do a developmental screening called the Ages and Stages Questionnaire. And you can actually complete a screening on our website by selecting the developmental screening tab. And in doing that, as a caregiver, once you complete that screening, a navigator can reach out to you at that time as well and go over the results. So there's a couple of different ways that you can go about connecting with our family navigators. And so this is a free program. There is no cost. It is a grant funded program, and we are serving actually 18 counties. Basically, when families call in, the majority of them have a variety of different concerns. After we do that screening, then we talk about what resources may be available to you in your area. And what's really neat about the database that we use called Find Connect is that you can actually access our database of resources through our public facing. And so the navigators are there, not just to provide resources, but to help you as a parent, be resourceful on ways that you can find programs that you're interested in, whether that be maybe you've got a speech concern, or maybe your child isn't walking, or maybe they're having some behavioral concerns at school or at home. We get a lot of calls from families who are just needing some extra support because parenting is really hard. And so, kids don't come with instructions, and it's very difficult being a parent right now, especially with everything that we're going through with the pandemic. And so many kids are at home, and it's just really difficult. So those navigators are well trained on helping you sort through as a parent what some of your options are. And in this knowledge base that we are creating, we can help you search for resources that are close to you. Maybe you're looking for childcare or a particular therapist or counseling. And we have almost 2,000 resources in our knowledge base that we're searching from. And we're constantly adding to that. We, as you can see, 18 counties in the DFW areas is quite a bit. And so we partner with a lot of different programs like ECI, like Gill, like Cooks, just a lot of different partners that we are building these bridges to help you as a family member find out what's out there. So I encourage you all to check out the website. There are some really neat tips on there as well about the parenting and milestones that you can track through apps. We recommend that families, download the milestone developmental tracker, and this helps you with being able to see, how well your child is doing. And then there's also quite a few milestone checklists, and then just different tips on our website for helping you as a parent.
I'm sure for a lot of parents, it can be easy to maybe compare with other kids and worry, is my child behind? And so that developmental screening, I'm sure, can help put a lot of parents at ease. And of course, the over 2,000 organizations that might be able to help, that's incredible. So let me ask you a question. So what information might parents need when they're contacting your call center at Help Me Grow? Did they have to have anything like on hand to reference? What would you recommend?
No, they just call in as they are. Any questions that you have about your child, or maybe you're pregnant and you might have some initial questions. We really recommend that families reach out for help and support. We need support. I'm a parent myself, and I need the support of teachers and programs like this, to help me when I have questions about things. So we just encourage you just to reach out. There's no specifications. We accept all calls. If you have a child who's over the age of 6, we'll still talk to you. We're not going to turn you away, but we might direct you to maybe some other programs that could, help you more in depth.
That's amazing. Thank you so much for sharing more about Help Me Grow North Texas. And Leanne, I might invite you to put your website in the chat so that everybody can access it quickly. And if you've got questions, let's keep those till the end. We'll get to you. For now, we have our last panelist, Frances Wampler. So she is the program coordinator for the Center for Children's Health at Cook Children's. She is part of a team that focuses on adverse childhood experiences, which we sometimes refer to as ACEs, and child abuse and neglect and prevention. So she's got a lot going on, and I am excited to hear more about what's going on with the Center for Children's Health. So Frances, go right ahead.
Thank you so much, Peyton. I am so happy to be here this evening and to share with you guys. As Peyton said, I'm Frances Wampler, and I'm a program coordinator here at the Center for Children's Health at Cook Children's. And we focus on ACEs, or adverse childhood experiences. And we do have a lot going on, but I'm going to highlight two of our programs that we're working on right now that really fit into this model of finding community resources. Next slide. Thank you, Elaine. So the first one that I'm going to talk about is Text for Tarrant Cares. And Text for Tarrant Cares just launched in April of 2021, and it is an extension of the already established web-based data portal Tarrant Cares. So we're going to talk a little bit more about Tarrant Cares. I want to acknowledge our project partners. This was very much a community collaborative project with the Mental Health Connection of Tarrant County, the Tarrant County Judge Beeklin Whitley's office, of course, Tarrant Cares, as well as Cook Children's. We also worked with some local organizations, Loretta Burns and AB Christian Learning Center. And then we partnered with families in the community who did some beta testing for us. So we worked with 34 families in the community when we were working on this project to get their feedback and to say, is this really helpful? How was it working with the platform? So we really appreciate all of their feedback and all of our partners' hard work. Next. So why texting? Our organization, as well as our partners, we heard from families a lot that they still struggle with knowing where to go and how to find help that they need. So our hope for this platform is that it's convenient. It's a 24/7 service, and it's going to be that bridge to the technology gap. Everybody has a cell phone or access to some sort of smartphone or device. So we hope that it's really going to bridge that gap. You can use it on any smartphone, and you don't have to be on Wi-Fi. So as long as you have some sort of connection. And then we really hope that it gives families that control and privacy and not have to fear any judgment or shame for seeking assistance, and give them the opportunity to advocate for themselves and have them give the opportunity to be their own navigator when they're looking for the services that they need. All right, so all requests that go through the platform are confidential. We do not store any of our users' information. So that's kind of nice just to have that in the back of your mind as you're using the platform. It does offer up-to-date information about local resources that we funnel from Tarrant Cares and 211 here in Tarrant County. Some of the resources in Text for Tarrant Cares are food and clothing, rent and utility assistance, mental health and counseling services, family support, early childhood care, substance abuse programs, child abuse and neglect services, and other critical needs. We also have a text that will follow up that will give you COVID-19 resources as well. So if you have a smartphone handy, I encourage you to follow along as I give you a demonstration of the platform. So what you're going to do is text the word find to our short code 67629. And on the right of the screen, you're going to see a screenshot. This was my phone when I was playing with the texting bot, and I thought it'd be really easy just to show y'all what it looks like. The bot is going to text you back and ask you what your preferred language is. So you will just press 1 for English or 2 for Spanish. And then it's going to follow up with a welcome text. And then it'll give you a link to follow to take you to the guided search. Now, these pictures may be kind of small, but these again are screenshots from my phone when I was playing with it. And you can use these just as a guide, but this is what it will look like once you click on that link. And the first picture on the far left, you'll see it's asking you for your zip code. So if you want the resource that's close to your home, you're going to want to put in your home zip code, and that'll find the closest resources to you. You can adjust that radius that's just under that zip code as well to expand your search. That middle picture will show you that it's going to take you through a series of 9 questions. It will automatically default to no, so you may not see all of these options under the question. If you don't need that resource, you just leave it at no and hit next, and it'll take you through all of those options. If you answer yes, it will give you that drop down where you'll see several of those other options, and you're just going to click the resource that you need more information on. You can select more than one. On the far right, you'll see your search. So at the very end, after you've gone through each of the questions, it's going to pull all of the resources that you selected yes for and those boxes that you checked that you needed more information on. And you can just click through there and go through them, and it'll show you the resources, where they are, and their contact information. This is a follow-up text that you'll get from the texting bot, and it's just a follow-up for COVID-19 testing and vaccination site information. That's an automatic thing. At any time, if you need to do another search, or if you got confused on the guided search, you can always come back to your text message and just type find again, and it'll start over from fresh, and you can do the guided search again. So that is all about Text for Parent Cares. Our next program I'm going to highlight is our Build a Bridge program. It's another program that we have here on my ACES team. The goal of the Build a Bridge program is to strengthen connections between children and families, healthcare professionals, and community resources. We like to be the bridge between families that are needing that connection, and then also community resources. We can help when a family needs a bridge to resources, community resources like Healthy Start, Help Me Grow, which we just learned about, early childhood intervention, MHMR, any community resources that you can think of. We have some connections there, as well as Cook Children's resources for car seat safety, safe baby sleep, water safety, our friends here in oral health, and asthma prevention programs. We also ensure that our families' insurance is up to date and make sure that they understand the importance of medical home visits, making sure that their clinic visits are up to date. And then we can help them identify a clinic. So maybe they just moved here or they're between physicians. We can help them make connections with clinics that are close to their home, whether that's a Cook Children's clinic or otherwise. We can help you identify a clinic in your area. Our community health workers will also discuss what to expect at well child appointments. We like to help caregivers anticipate questions from providers and help them prepare their own questions that they might have about their kiddo, discuss any obstacles or barriers that they may have with their communication, and just help parents get ready. Like we've already talked about, there's not really a guidebook when it comes to having kids. And so those well child appointments can be a little intimidating. So we want to make sure that we empower families during those appointments. Our community health workers will also discuss the importance of developmental milestones, how to talk to your provider about concerns that you have or questions that you have about your child's development, educate them around how to notice different things. And next slide, please, Elaine. We talk a lot about the Learn the Signs Act Early application and program. So helping them learn, download that application, teaching them how to track their child's milestones. They can create those developmental child checklists. They can do those from 2 months to 5 years. So we can help families walk through that as well. And here's the contact information. If you're interested in the Build a Bridge program, this is our direct email. It's buildabridge@cookchildrens.org. The information that they would need is your name, contact information, whether that be phone or email, and then the need or the request. The best way to get into Build a Bridge is just to email us directly. And then if you have any questions about Text for Parent Cares or the Build a Bridge program, I'm absolutely happy to answer any questions that you might have. And here's my contact information. I really appreciate y'all having me this evening and letting me share a little bit with you about our programs.
Thank you, Francis. No, that both of those programs are really exciting, and thank you for sharing more because I wasn't aware of either. So very exciting. I do have one question for you before we
Yes.
open the floor to everyone. So when you're using Text for Tarrant Cares, are you chatting with a live person or with an automated service?
I'm so glad that you asked that question. You actually are not texting with a live person. It is just like a texting bot. So it replies to you based on what you're saying. We do encourage families, if they want to talk to someone, to call 211 if they want to talk to someone specifically about resources. And then if it's a life-threatening emergency, of course, to call 911 because the bot will not be able to recognize that you have an emergency.
Sure. Chatting with a bot sometimes, less pressure. So that is wonderful. Thank you so much. I want to thank each of our panelists for sharing more about their programs today. And I'd love to open the floor for some questions from our guests. If you've been thinking on them throughout this evening's presentation, now's the time to ask away. And if you're more comfortable on chat, you can send that question via chat as well, or you can unmute yourself. Whatever works for you. And while you're thinking on that, maybe I'll ask some follow-up questions for our panelists here. So Francis had mentioned, how you talk to a provider, and which brings up a question that maybe I would pose to Dr. Gowda. So Dr. Gowda, what would you recommend, when a parent's accessing the ER, it's already a high stress situation, how would you recommend parents communicate with the ER doctor? Any special tips?
I think the first thing is like to keep your nerves calm. So when you go to the ER, make sure you gather all the information which is necessary. Don't forget to take your identification cards and insurance cards and payment information, and also any medical information you have, like just a list of some medication, which is probably going to be very useful when you go to the ER to talk to the doctor, because in stress and anxiety, like you forget the names of medications most of the times, and they won't be able to get that information. And also, I think it's very important to take your cell phone. Don't forget your cell phone and the charger, because that's very necessary to communicate, especially with your friends and family. And you don't want to run out of charge in the middle of an emergency. And also, if you have any medical history documentation, probably that's good to take if you can. If you have everything in handy, just to grab. And also contact a family member or a friend to take with you. That's going to be useful.
Those are all really great suggestions. So it's not a bad idea to have sort of an emergency kit ready to go and know where all your important documents and your cell phone charger is. I know I need that advice sometimes. So let's see, what else could we ask you guys? So we're hearing a lot about going to your regular visits at the pediatrician, your regular visits at the dentist. I'm curious to hear from our panelists, how many times are you seeing kids going to the ER because of something that could have been treated ahead of time at one of those doctor's visits or those 6 months cleaning at the dentist? Talk to me about that.
Yeah, this is very often most of our kids, they go to the urgent cares and ER when it's not necessary, and they come for follow-up with pediatrician. A lot of things, as I explained earlier, just a fever, or cough from the nose or sore throat, like simple things. You don't have to go to ER or the urgent care. You can always call your pediatrician's office, whether they can get the same day appointment. If not, probably they'll tell you to manage symptomatically, or if it is necessary to go to urgent care, so they will let you know. The best resource is to call your pediatrician's office to know whether you have to go to urgent care or something you can wait. But now there's another great option: telemedicine.
Yes.
Teladoc and MD Live, you can get great advice there. If you have a question whether I should take my child to urgent care or ER, and you're not able to contact your primary doctor's office, most of the insurances, they provide the service. You can call from your home at your convenience to get the right advice. to see whether you can wait till next day morning or like for a few hours to see a doctor instead of going to the urgent care.
Great suggestion. And that is one of the few silver linings of this pandemic, isn't it? That our doctors, our providers, connecting with them remotely has become so much simpler. And that can be really a lifesaver for parents who are trying to decide what to do with their injured or sick kiddo. So thank you for that.
You're welcome.
To our guests, do you have any questions for our panelists? I'd love to open the floor. Oh, I have one from Sarah here. Does Cook have craniofacial team or resources or providers that could provide, let's see, good continuity of care? She's got a few providers that she refers to, but it would be great to have a team that could regularly discuss care of these child patients. So does anybody have a response to Sarah's question? Dr. Gowda, do we want to talk a little bit about what she means by craniofacial team?
Well, I'm not sure about the question. Is it some major craniofacial malformation which requires like multidisciplinary approach? Probably the major children's hospital like Cook's and Children's Health, should have a team taking care of those. And if it is just a minor problem like the shape of the head, they do like if they have a like flattening of the head on the back, which we call plagiocephaly. So then there are other companies which provide helmets. So they do have those services available. So I was able to give answers for both the major and minor problems, but I'm not sure like what the question is focused on.
Sure. And I can actually speak a little bit to that. So we at Guild Children's Services will see infants who need what Dr. Gowda is talking about, like a cranial helmet or a dock band, from anywhere from mild to severe. I don't know the medical terms, y'all. You know what I mean. So when they need access to that, a lot of times insurance will only cover severe diagnosis. So it leaves those kids with mild to moderate sort of out of the loop. And so we can step in and help pay for cranial helmets in some cases. So that's a good time to apply with Guild Children's Services. But Sarah, regarding your continuity of care, so how that really happens is we would get a referral maybe from Cook, a Cook social worker or another pediatrician, or even from the cranial helmet manufacturer. Sometimes they're telling the cranial helmet provider that they cannot afford it and they will refer over to Guild Children's Services. And then from there, they will take up treatment with their current pediatrician. So that's kind of how the treatment works that I've seen. But if anybody else has anything to contribute to that question, please feel free. And Sarah, let us know if we answered your question. Okay, anybody else got anything for these panelists to discuss?
Peyton, I have a question for you because
Okay.
you do work with financial assistance for unmet need, like the example you just used.
Mhm.
What is the most unusual unmet need that you've assisted with?
Oh gosh, there's a lot. I'll give you a few examples. How's that?
Okay.
So one that I share all the time is that we had our friends over at Save a Smile identify a child who needed a dental work, and they had arranged a dentist to do it for free. And they found out that the child had lice and they couldn't get dental treatment while they had lice. And so the social worker at Save a Smile reached out to us saying, can you help treat this family with lice? They've been, sleeping on cots on the floor, and it's been really hard to not pass it from one sibling to another. They just couldn't get rid of this darn lice. So we provided them with a company that would come into the family's home and treat all the soft surfaces, treat the family to make sure that that lice was eradicated and that child could get into the dentist. So that was a special one that we have seen one and one time only. We've had a child who was playing with a lighter and unfortunately burned a large percentage of his body. And I don't know if you guys know, but sometimes when you're a burn victim, depending on how much is burnt, you have a hard time with perspiration and regulating your own body temperature. And so this child, we live in Texas, it's really hot outside, and the family did not have AC in their car. And so traveling to and from anywhere in those summer months put that child at risk for seizures and other complications because he could not sweat. And so we paid to have a new AC unit installed in the car to make sure that that child wasn't medically at risk. So those are a couple examples of things that, aren't covered by traditional insurances, and there aren't charities set up for lice treatment or putting AC in cars. But that's okay, because that's why Guild Children's Services exists. You can come to us with all those special emergency needs. Thanks for asking.
Yeah, no, because a lot of folks, when you think of unmet needs, you don't really know what all that could be. So I think you all just heard her say just about anything that's not provided somewhere else. She did not pay me for that either. Francis, I have a quick question for you. When should a family reach out to build a bridge?
We will pretty much work with any family. If there's a family that is concerned about their child's development, absolutely reach out to us. If it's a family that's new in the community and is needing help finding a pediatrician, we're happy to help there as well. Our target kind of age group is 0 to 5, but we're not going to turn a family away just because their children are older than that. We will work with any family that reaches out to us. So yeah, anytime they have any concern about development or needing help finding a medical or dental home, we're here to help.
Fantastic. Thank you so much. Okay, guys, we just hit the 7 o'clock hour. So before I turn this over to Elaine to close us out, I just want to thank our panelists for sharing their evening with us and sharing much needed resources. You are so very appreciated. And if you have any questions, again, hit us up in the chat. We'll be available after this. But for now, I'd love to turn it over to Elaine, our hostess with the mostest.
Thank you, Peyton. Let's give not only our moderator, but our panelists a round of applause, guys. You all have been absolutely wonderful. This has been great information and definitely will be shared with others, because what is it they say? You don't know what you don't know. And now we know some great resources in the community that we can share with families. And I also want to say thank you to Leatrice Anderson, who is our sponsor today from Aetna. Leatrice, thank you for being our sponsor today. And again, I just want to say thank you all so much for your continued support. Panelists, again, that was great information. Thank you for giving that time to us today. We really appreciate it. And to our participants, thank you, because you could have been somewhere else today too, but you chose to come here to get that information. And I hope that we have been a resource that you can use, and not only use, but you can share with the people you're in contact with. So thank you.